Hello, my name is Nigel Wainwright. I'm a clinical psychologist. I work here at Mid Yorkshire Hospitals NHS Trust as part of the Occupational Health and Staff Wellbeing Service. This is a short video just to talk about normal human responses to the current situation regarding COVID-19. We're all experiencing high degrees of uncertainty. These are unprecedented times, high degrees of stress, lots of worry and anxiety for us and for other people in the world right now. And it's important, I guess, to recognize that that's going to have an impact on us from an emotional point of view. We're going to feel some stuff about what's going on. And whatever we're feeling, it doesn't necessarily mean that that means that there's something wrong with us, that we're broken, that we can't cope. There are a number of very, very normal human emotions that people will be experiencing right now that just mean that you're a human being. It might be the case that you've noticed right now that you're experiencing some emotions that wouldn't normally be around for you quite so much. It might be the case that you're feeling worried, anxious, increased stress, more tense than you would do normally. It might be the case that you're feeling panicky. It might be the case that you're struggling to concentrate more than you would normally. You might be feeling or noticing that you're finding it difficult to get to sleep. On a night time, maybe there's things spinning around in your head. Perhaps you're waking up in the middle of the night noticing that your mind's very active, thinking and worrying about things. You might be feeling more frustrated, more snappy than you would do normally. You might notice that you're, in relation to that, more angry, more easily at the end of your tether. You might notice that you're feeling low in mood, maybe sometimes even feeling depressed at times, particularly if you've experienced depression before. It might be the case that there's feelings of fatigue. You might feel burnt out because of the impact of work. It can be really, really busy. Depending on where you work, it can be really busy for us right now. It can be a lot on our shoulders, and that can leave us kind of with that sense of feeling burnt out. And we might feel sad. We might feel sad about this situation. We might feel sad for the people that we care for, people in our family, and we might feel sad for us, or just for society more generally. Again, it's important to recognise that in a situation like this, there's no feeling right or wrong. We don't have a model for this. We've not experienced, many of us have not experienced anything like this before. So whatever we feel right now is a valid human emotion. It's how things are for you right now. It's how you feel, and it's to be felt. It doesn't mean to say that there's anything wrong. And perhaps it can be helpful to try and press pause, maybe step back, recognize that that you're experiencing this stuff right now. Maybe talk to your colleagues about it. If you're feeling this stuff, there'll be other people in your team who are feeling similar emotions to this. And it can be useful to recognize that with each other and open up that potential for peer support if you feel able to. So following a highly distressing, potentially traumatic event or series of events, it might be the case that we have a heightened sense of anxiety. It might be the case that we feel more alert, on edge, maybe more jumpy, maybe more hypervigilant than we would do normally. We might notice feelings of anger, feelings of guilt. We might bargain with ourselves about whether something's happened or not. Might be a sense of denial. It might not feel real. We might go through periods of time questioning, ruminating on something that's happened, whether it should have happened, that it shouldn't have happened, whether things could have been different, whether there's something that I could have done that would have made the outcome be different, or somebody else could have done that would have made the outcome be different. We might feel angry towards ourselves, towards society, towards this situation, towards other people in our team or who were there at a particular event. It might be the case that we experience a sense of shock. We might notice differences in our ability to concentrate and to focus. We might find ourselves pulled into thinking about what's happened at different times. It's quite normal as well to experience intrusive memories. So we might have intrusive memories or thoughts, images of what's happened. And these can come when we're awake, when we're not expecting them. We're not inviting this stuff in. It's automatic, it comes uninvited. Our mind just serves as this stuff up. It might be the case that it comes in our dreams. It might be the case that we're dreaming about what's happened, or things that might bear some resemblance to what's happened. It might be the case that those dreams are highly distressing. We might term them nightmares. Experiencing things like this is not nice. It's not something I would choose for you. But it is normal, given the experiences that you might have had. If you've had highly distressing, potentially traumatic experiences when you've been at work or outside of work, then experiencing these kind of psychological reactions, these kinds of experiences in the first month, maybe up to 3 months following that event or that period of time, it can be related to your mind's normal way of trying to make sense of what it's experienced, really, to process what it's experienced. And therefore that is a normal human response. It's not nice. And you might have an urge to try and squash it or to move away from it, to avoid it in some way. So within that first month particularly, if you can, just try and allow whatever happens to happen. If this persists beyond a month, particularly if it persists beyond 3 months, or if your experience of these symptoms is so distressing that it's getting in the way of your everyday functioning, then I would recommend considering referring yourself or seeking a management referral to occupational health so that we can have a conversation with you about how you might be able to manage this. If this does persist, then there are some things that we can do to help. There are some very specific evidence-based therapies to work through this so that you don't have to be bothered by it so much. I hope you found this useful. Do make use of the support structures that are there available to you as part of the My Wellbeing Matters support service. Details of that are available on the intranet. Thank you.